Hi, everybody. This is the Dr. Debunk Weekly Podcast Show. On this show, I'm going to be debunking the medical myths, garbage, and crap that's spread by doctors and other health professionals. Dr. Debunk is the medical truth teller. The title of this podcast, everybody, is The Dirty Little Secrets of Doctors, Part 1. Ooh, what is that? What's Dirty Little Secrets of Doctors? Doesn't that sound interesting and like mischievous? Or maybe just mean-spirited on my part. Ooh, I like that. You know, it's okay for me to critique doctors because we can take it and we need critiquing. What is the Dirty Little Secrets of Doctors about? Well, a number of things. Things that we do and say that we really shouldn't be saying and doing. And then things that we are not doing that we should be doing. What's the number one dirty little secret of doctors? It is that we have almost nothing to do with the prevention of disease and even less to do with anything that's related to optimal health, education, training. Doctors and medical treatments don't mostly cure disease. We just maybe kind of prolong life if you have disease and give you a better quality of life if you have disease. But what does that have to do with people that don't have disease? Nothing. That's what it has to do with it. It's really kind of nutty if you think about it, but you go to your doctor and you get treated with a disease-based treatment even when you're not broken with disease. I mean, think about that for a second. Now, to be fair, there's some exceptions to this, but even these exceptions can be greatly exaggerated about what we really cure and don't cure, or do we do anything to prevent disease. I mean, to be fair, we do cure infectious diseases like pneumonia and many others. We do prolong life for cancer patients and cure some, but it's less than you think because we really have a funny way of defining cure. It's really screwy. To say we cure most cancers is a great misunderstanding at best, or a lie depending on your point of view. But I talk more about cancer and that whole problem in a different discussion. Now, surgery can cure many diseases, but it can be misused and overused. And the list goes on and on. To understand this better, let's talk about what do us doctors do anyway? I mean, what do we really do? Well, we go to medical school to learn how to do the early detection of disease, the diagnosing of disease, and then the treatment of disease. So let's talk about those three things. Early detection is just that. Most of our testing and things like that are designed to find disease early. And that's good. That's really beneficial. And then the second thing we do, we diagnose it after we think we're detecting it, and then we treat it. Early detection, diagnosing, and treatment. And then after medical school, 95% of what we do as far as continuing medical education is just more of the same. Do you hear any words in there about prevention or health and wellness or optimal health training? Nope. And even further away, or the farthest away from this, is what does it take to make patients optimally healthy, which in most cases prevents the formation of disease. Now, you may think that's not possible, but it absolutely is. The truth is, we doctors learn nothing about prevention or optimizing patients' health, and yet patients think we know something about your health. The average doctor thinks that the early detection of disease is the same thing as prevention. Debunk, not true. Dr. Debunk alert. In case you haven't heard that before, when there's something really dopey and untrue we do in medicine, I say Dr. Debunk alert. And this is a debunk alert because we don't. And you patients think that early detection of disease is also prevention, but it's not. It's valuable, it's important, but it's early detection. Okay, now a word from our sponsors. Hi everyone, it's the cold and flu season again, and this year's pretty nasty. Well, do you know what the best cold and flu remedy is? Well, it's a remedy that would be natural, strong, kills viruses, and has some science to show that it really works. Well, that's KSK Cold Spray. KSK Cold Spray is an all-natural, germicidal spray that eliminates cold and flu symptoms in 24 to 48 hours. I proved it in a study of 200 patients, and now we've probably had 700 people that have used the spray. Every year it's curing hundreds of my patients. So don't be miserable anymore. Go to kskcold.com, that's kskcold.com, and you'll love what you read. I'm Dr. Debunk, the medical truth teller. Welcome back. So then, what is another way to define the first dirty little secret in medicine? It's that medicine and doctors define the early detection of disease as prevention, but it is not. And as I said, you patients think that's true also. Now, early detection is important, but it's not prevention. Because you find it early, that's good and valuable, but you still get the disease anyway. It's not prevention, we just find it early. So what does that look like in real life? Well, let's talk about what most people do. I mean, if you have decent insurance and you're over 40 or 45 or 50 sometimes, you go get an annual checkup with your doctor, which has nothing to do with prevention. It's just a checkup for the early detection of disease. But has anyone ever told you that? I mean, you think after the exam and you have blood tests and everything's normal, you think that you're okay and you're not moving towards getting disease at some kind of accelerated rate. And you think you're not doing anything that's taking away your health. But wrong, wrong, wrong. Debunk, debunk, debunk. That exam, no matter how special it is, like I live in Central California, and people here with good insurance and some money, they'll go to Stanford or Davis or Santa Barbara, and they'll get some hoo-hoo physician to give them some hoo-hoo exam, and maybe they can talk them into an MRI scan or something. And they get all this stuff done, and the doctor says you're fine, it's great, and you think that it has some kind of value in determining how fast you're aging, and it has no relevance to how fast you're moving towards disease. This is what it means when your hoo-hoo exam is all good. It means that right now, with this normal checkup, we see no signs of the early onset of disease. That's it. Now, in all fairness to my kind, the doctor kind, this is a good service. I mean, it really is important. But my beef with medicine is we've been doing this so long that we start to believe it too. And we're not telling people what it really is. It's an early detection exam, not a prevention exam. Now, many of the hoo-hoo doctors that go to a hoo-hoo university will hear this and say I'm full of crap. They will say that doctors do prevent disease and cure more than I'm saying. Well, let's see if we can use the basic facts of reality, the reality of outcomes of people's lives, to see who is correct. Is Dr. Debunk full of crap? Or is mainstream medicine full of crap? Let's start with the U.S. government. I mean, they track who dies in America, what Americans die of. 70% of Americans die of heart disease, cancer, lung disease, stroke, and then a combination of other organ failure disease. Well, what about people that don't die of disease? They die of old age. Now, that's something you may not know. Most people don't think about it or realize. You don't just die of disease. Everybody thinks that, oh, we're going to die of some disease someday. No, wrong, debunk. A small percentage of people, less than 5%, die of old age. That's where an organ system just wears out, and then you expire. Now, 95% of people do die of disease, but not everybody. And if you look at people that just wear out from old age, based on the cumulative evidence of, say, the last 40 years, they live to be 105 plus 5 minus 5. I mean, how do we know that? Most obviously from the data that's collected. Because people all over the world, in fact, die of old age around 105, with no signs of disease. You could ask any coroner in the world that studies dead people and ask him the question, could he tell the difference between somebody that died of old age or somebody that died of disease? He'd say, oh, right away. You can look at the organs, you can cut them open, you can look at everything and see. Now, what determines that, why people die of old age versus disease, is a whole nother movie. It's all about the 10 factors of optimal health lifestyle, which I discuss in other videos. But for this subject, it's sufficient to say what I said is real because, in fact, people do make it to 105 with good quality of life, pretty much all the way there, with no overt signs of disease, and then they die. So what's the point? Well, ergo, I love that word. If what we do in medicine really prevented disease, for example, like using medications the way we do for any and every problem, doing the annual checkup and all the things we do as doctors, if all of that worked, why are Americans dying from 78 to 82 years old? It seems like it's getting a little longer, although that number is going to reverse soon. Americans are going to be dying sooner, younger ages. Why don't all these drugs and surgeries make us live to the optimal 105 years old age? If what we do is truly preventative, why are we still dying of disease, not old age? And why do we die at around 80 years old or less? And furthermore, why do people that generally live to be 100 have minimum contact with doctors throughout their lives? That's a sarcasm alert, by the way. Anyway, the truth is, it's because what we do as doctors extends the quality of life with our drugs and surgery once you have disease. You will live longer with the drugs plus disease than if you had disease plus typical American lifestyle and no drugs. And what that means is, if you ignore your disease, say high blood pressure, you will die sooner of a heart attack or stroke than if you took the medications which controlled your blood pressure. But we're not preventing cancer or heart disease or anything else. We're just delaying the onset and then helping you live longer once you get the disease. Now, this statement is a reality based on what has actually happened over the last 50 years in medicine and is still happening today. Facts and reality do not lie. Dying of disease is very different than dying of old age. For 32 years, I've watched patients die of disease. And now I'm trying to get patients to live the exact opposite lifestyle that produced disease. By definition, that is an optimal health lifestyle. To give you just a quick example of that to drive it home, let's say you start to get high blood pressure around 45 years old, which is pretty common today because of the American lifestyle is so pathologic in many ways. Younger generations are living more screwy than ever before. And so you ignore it. Well, if you have pretty good uncontrolled blood pressure for 10 to 15 years, you're going to have a heart attack or stroke. I can't tell you exactly when, but 55, 60 tops. If it starts at 45, you're going to stroke out or have a heart attack. And if it's serious, you could die. Unfortunately, when people have heart attacks and strokes in their sleep, they usually die. So you could be dead at 60 because you began to have the early symptoms of disease. Having high blood pressure start at 45 is not a disease, by the way. It's abnormal physiology occurring from a screwy lifestyle. Anyway, but if you took your medications, then you wouldn't have a heart attack until you were like 75-ish or so. You're still going to get the heart attack because the blood pressure is being controlled. But the blood pressure elevating is a manifestation of a crappy lifestyle. And that lifestyle is causing other damage to your body, which in the end is going to make you have a heart attack or stroke just later on. You're still going to get it. It'll just be the typical disease-based optimal lifespan that doctors say you'll get, 75 to 82-ish. That's what the numbers are. I'm not making it up. These are the numbers. You're still going to die of a heart attack or stroke because you never fixed your lifestyle. You just took a drug that extended your life. Now, this is reality, folks. The answer for non-diseased people, which is most of you, is to fix your lifestyle problems that are causing the blood pressure to start, the high cholesterol, the diabetes, the other factors of the beginning onset of what we say is disease. I suppose that's accurate, but it's not disease yet. You're just marching down the road that will give you a broken organ system. So, to conclude part 1, this may all sound very depressive and cause you to doubt your doctor. But don't do that. Be of good cheer. It's not depressive, it's exciting, because now you can embrace the truth and not living with your head stuck in the ground, not believing that the doctor can do something for you that he can't or she can't. You now can realize that you have to learn how to live an optimally healthy life, which will prevent disease in most cases and promote excellent quality of life at all decades of life. You can set your doctor free from your false expectations that he or she can keep you healthy. You are responsible for your health outcome, not the doctor. The doctor can help you with intermittent medication for all the nuisance symptoms relief from your allergies or cold or flu you get, or maybe bronchitis, and if you smash yourself because you did something dopey, whatever. There's many things we do that are not disease-based, and drugs are great. Drugs are great for short-term intervention. But as a reminder and as a conclusion, you have to stop using drugs when you're not broken with disease to fix a problem and act like that's okay. It's not okay. Here's why. Every drug you take on a daily basis will kill your liver or kidneys in 30 to 40 years, or some other part of your body. Now, there might be a few exceptions, but we don't know because nobody studies it. We just see the train wrecks periodically in medicine. And after 32 years, I've seen a lot of them. So here's the practical way to say it. Stop going to a carpenter to get your car fixed. It doesn't work. Carpenters and mechanics both use tools, but good luck with a carpenter taking a hammer or a skill saw to fix your car. I'm Dr. Debunk, and this whole subject has been debunked. Hi everyone, it's the cold and flu season again, and this year's pretty nasty. Well, do you know what the best cold and flu remedy is? Well, it's a remedy that would be natural, strong, kills viruses, and has some science to show that it really works. Well, that's KSK Cold Spray. KSK Cold Spray is an all-natural, germicidal spray that eliminates cold and flu symptoms in 24 to 48 hours. I proved it in a study of 200 patients, and now we've probably had 700 people that have used the spray. Every year it's curing hundreds of my patients. So don't be miserable anymore. Go to kskcold.com, that's kskcold.com, and you'll love what you read. I'm Dr. Debunk, the medical truth teller.